Hello again. I'm Dr. Maurer, a licensed psychologist at the Medical University of South Carolina and NCI-designated Hollings Cancer Center. This is the second video in the BRIGHT program. Today, we'll be watching a video called Post-Treatment Side Effects. This 30-minute video will address a number of side effects from treatment that may be challenging for head and neck cancer survivors. I hope you enjoy this video.
Ways to manage physical changes. Some have described survivorship as being disease-free, but not free of your disease. You may find that you are still coping with effects of treatment. It can take time to get over these effects. It's important to remember that no two people are alike, so you may experience changes that are very different from someone else's, even if that person had the same type of cancer and treatment. Most people have side effects during and for a few weeks after treatment for head and neck cancer, but sometimes certain side effects may last longer or be permanent. Light effects after treatment can include physical changes to the head and neck, such as dry mouth and changes in saliva production, damage to teeth and jawbone, pain or stiffness in the jaw, neck, and shoulders, changes to taste, eating or drinking, changes in appearance, changes in hearing, fatigue. This may be specific to the type of therapy you have received, either surgery, radiation therapy, chemotherapy, or a combination of these modalities. In this next video produced by the American Society of Clinical Oncology, a medical oncologist will describe how to manage side effects resulting from chemotherapy.
Chemotherapy are potent drugs that can kill cancer cells. These are cells that are rapidly dividing. Cancer cells are often the ones that are moving most quickly. And other normal cells, like your hair cells, the lining of your mouth or your gut, are also ones that are replicating quickly. When chemotherapy is given, it affects all of those cells. It's trying to hit cells that are actively dividing, and there's some spillover. Although we think that we can get mainly cancer cells with chemotherapy, sometimes we'll have off-target effects on those other sensitive cells. Most people are very fearful of starting chemotherapy, often because they've been touched by cancer at some point in their lives. They had the neighbor or the aunt who had to undergo chemotherapy 20 or 30 years ago, and were in the people and the memories that they have are of people totally incapacitated by their chemotherapy. We've come so far, and in recent years, we understand how to give good targeted medications that reduce nausea. We're able to give drugs that are much less sedating. Often patients are able to get chemotherapy and continue to attend to their daily tasks. Often they can go to work within a day or two. They're able to take care of their families and lead really full lives. I think it's hard when you've had some sort of history to begin your cancer journey that you recognize that truly we've come to a new chapter for many people, and chemotherapy can be much more tolerable. So we know that there are side effects like lowering of blood counts that are common to many chemotherapy drugs. Some chemotherapy drugs cause people to lose hair, others don't. Some cause damage to nerves, and others don't. Some can cause diarrhea, others cause constipation. Each side effect is unique. Almost universally, chemotherapy causes fatigue, and that is something that we are constantly battling. But understand that combination of drugs together, and particular drugs, can be very different for different diseases and in different patients. It's important when you begin cancer treatment that you understand what drugs you're getting, why you're getting those drugs, and what to expect from those drugs. And by that I mean, what kind of toxicities can one expect? And it's important to begin your journey with as much education as possible. So to know that if I'm starting a drug, what will my next 3 weeks be like? Will I feel good for a few days? What symptoms should I worry about in the next week? Should I call if there's something out of the ordinary? What should my expectations for work and family balance be like over the duration of my treatment? All of that information up front can help. It can be really tough to get that information in bite-sized pieces in many cases. Often people have been given a tough diagnosis, and they start sort of this whirlwind of meet our nurse, meet our social worker, meet the nutritionist, let's start chemotherapy next week. By understanding the side effects that you may experience when you're beginning your chemotherapy journey, it's very likely that you can reduce toxicity and side effects. So the nurse that's treating you, the physician that's treating you, the physician assistant or advanced practice nurse will all give you a lot of information about toxicities you may or may not experience. Things that we do routinely are we give drugs that decrease the likelihood of having an allergic reaction to chemotherapy. So sometimes you'll get steroids before you get a particular drug. We have come so far in recent years in preventing nausea with good antiemetic agents, and so you'll often be prescribed oral drugs to take at home after you receive chemotherapy to prevent nausea. So again, you'll get a myriad of drugs to take at particular times in your treatment. I think the most important thing that you can do is to understand what side effects you may experience, and with that, ask the question, what can I do to prevent this? And sort of that knowledge will help patients and caregivers through this first weeks of chemotherapy in particular. We have many patients who have minimal side effects and are able to continue working and caring for their families and leading normal lives on chemotherapy, and that's really our goal for all patients. There are many things that patients and their family members and caregivers can do together to decrease the side effects and toxicities of chemotherapy. So I always say being as healthy as you can be in every day is important. So making sure that you're getting good nutrition, making sure that you're as active as you can be. A lot of that is listening to your body, and there will be days that are good and you feel like taking a walk and being outside. There are other days that you feel worn out.
Many other side effects may result from radiation therapy specifically. This next video will highlight a couple of patients' experiences dealing with radiation therapy.
So my first treatments were external radiation and chemotherapy.
The combination of radiation and chemo, it really knocked me out. It was much more intense because of the combination of the two.
The radiation really,
Knocked
me out.
Getting up every morning, you're extremely exhausted from the radiation. It takes a lot out of you.
The radiation therapy was 6 weeks, 5 days a week.
The first 2 weeks of your radiation, about 10 segments of it is called the honeymoon period, where you go for treatment every day, you really don't feel anything.
You do all right for the first couple of weeks, but then you get weak. I remember I couldn't even stand in the shower.
The radiation, which is a very powerful treatment, created some scar tissue.
I was on incredibly high doses of oxycodone and the fentanyl patches you wear 3 days on each side.
Your skin gets very damaged, and so I had basically like a red kind of patch after the radiation.
You have radiation, everything inside is disrupted, your tissue, good tissue, bad tissue, cancer tissue, it's all burned.
It's a little difficult to get used to the first few times, but once you realize that I just relax, and I've done some breathing exercises which helped. I also ran some music in my mind. I would sing some songs to myself to get through.
But it's part of the walk, you're fighting something, cancer.
So you can talk a little bit about how you felt emotionally. You can talk a little bit about how you were doing physically, how your nutrition was going.
And you mean like the end of radiation?
Mm-hmm.
Yeah, the end of radiation was horrible because I had gotten sick and was throwing up 10 times a day and couldn't eat anything, couldn't drink anything. And I refused to get the feeding tube. I didn't feel like I needed it. My doctors didn't feel like I needed it. And I'm still glad today that I didn't get it. But the radiation was worse than what I thought it would be. They told me it would get bad the last couple of weeks, and I had developed an infection. So in the meantime, I had to be hospitalized, I think for 4 days, and have surgery, guess what, 2 weeks in? Radiation, 3 weeks into radiation is when I got the infection.
You didn't have, no.
That's when
You
I,
didn't have
then when the mask didn't fit, because what happened was, you know, they put a big mask on you and pin you to the table, and it kept choking me. And then finally one night, an infection had developed, and I came down on a Friday night, got admitted, and they got me back out Monday morning so I could get back to radiation. So from there, it got to the point where the sunburn was so bad. I guess, I mean, I say a sunburn, but it was beyond the sunburn. And the taste buds got to the point where food tasted, to me, tasted like gasoline. So I didn't want anything in my mouth. I mean, even water tasted like gas. So I quit eating, quit drinking, quit doing anything. And but it never got me down. I didn't care. I mean, it's like, it's just another hump in the road, and I'll deal with it. And they actually, I guess, at my last radiation treatment, they put me in the hospital and got me on fluids. And after 4 days, they got everything straightened out, and it's pretty much been good since then. So.
Okay, so you had some challenges with you did not want to eat. Was it an appetite loss, or just everything tasted so terrible you didn't want to eat?
Mainly everything tasted so terrible that I didn't want to eat. It's just that, I mean, it's because as soon as even if I took a drink of water, immediately I'd start throwing up. And I guess it was the taste. Because like I said, it tasted like just drinking, even a glass of water tastes like gas. And it's like, I can't.
And you had that terrible mucus in your throat, and you threw up over and over and over and over.
Yeah. I was throwing up 10 times a day at least. And it got to the point to where even the thought of drinking something or eating something made me start to so it's like I didn't even, so I went, 2 weeks? Went 2 weeks without anything to eat or drink. And that's when I had to be put back in the hospital, get some fluids. And my radiation oncologist, he was giving me IV fluids, I guess the last 10 days of radiation. He was giving me IV fluids before the radiation, so trying to just get some fluids in me, but it just wasn't enough, you know, so that's why I had to be readmitted here, so.
Dry mouth to some extent, but again, after advice from a fellow patient, I drank a lot of water. So, and partially to make myself feel full, but also just to prevent having that dry mouth.
A common problem head and neck cancer patients have after radiation treatment is having a dry mouth. It is expected that 90 to 100% of head and neck cancer patients will develop some degree of oral complication. Dry mouth is due to direct damage to the salivary glands, which are responsible for producing saliva. In addition to the major salivary glands existing on the sides of the cheek and under the jaw, hundreds of minor salivary glands lining the mouth are affected. Irreversible damage to salivary tissue can occur with doses as low as 26 gray, which is less than half the dose typically used to treat head and neck cancer. Patients with dry mouth should do the following to minimize symptoms and side effects. Maintain hydration with water intake. Avoid dehydration by minimizing caffeine and alcohol intake. Avoid sugar containing gum or soft drinks. Use alcohol-free rinses to maintain oral hygiene. Maintain routine dental visits. Use fluoride trays or drink fluoridated tap water. In addition to dry mouth, head and neck cancer patients may have other mouth and teeth problems such as cavities or dental caries, loss of or change in sense of taste, pain in the mouth and gums, infections of the mouth, jaw stiffness or jawbone changes. If your mouth is sore, remember to stay away from sharp, crunchy foods like chips that can scrape or cut your mouth, foods that are hot, spicy, or high in acid like citrus fruits and juices which can irritate your mouth. Sugary foods like candy or soda which can cause cavities. All tobacco products, alcoholic drinks. Next is a patient giving a couple of helpful tips on maintaining dental health.
Everybody that gets radiation, don't say you want to go see your dentist. You gotta tell them you have to go see your dentist. You have to get real serious dental care. You have to use high fluoride mouth rinse and toothpaste because the radiation is going to kill some of your teeth. And when I wasn't eating, I didn't think about oral hygiene. I didn't pursue it. So I finally got back to the dentist. I had like 18 cavities. 3 of my molars just rotted and fell out. And another one of my teeth just broke off the other day. So it's still an issue. And it's kind of expensive to get all that stuff replaced. But they say it's kind of expensive. Now the saliva issue was a really main issue. Right up until the time they let me start eating. Well, I had a tube and I had a feeding tube. And all during that time, I was using that. That's why I wasn't paying attention to my teeth. So during that time, because of the radiation, I had no spit. It was totally gone. So I got the brand name with their lozenges and gum and stuff that I use. That did help out. Eventually, my saliva glands recovered. So now I'm pretty much free of that. But for a while, it was an issue. Probably part of why my teeth got so bad.
Another common problem head and neck cancer patients may have is difficulty swallowing, also known as dysphagia. While dysphagia can have many causes, often after radiation treatment it can result from scar tissue formation contributing to a narrowing in the throat or esophagus. Such a narrowing is called a stricture. What are the signs or symptoms? Signs or symptoms of dysphagia are highly variable. You may experience coughing or choking when eating or drinking, sensation of food getting stuck in your throat, food or liquid passing into or out of your nose with swallowing, decreased ability to chew or swallow solids, unintended weight loss, increased time required to eat a meal, difficulty swallowing pills or tablets, recurring pneumonias from aspiration. In addition to dysphagia, patients may experience dysphonia or difficulty speaking. Dysphonia can similarly result from radiation therapy and may present with the following symptoms: reduced pitch variability, reduced loudness, reduced phrase length, hoarse or breathy voice quality, vocal strain, vocal fatigue. Next, we will hear from a series of patients on how they manage symptoms of dysphagia and dysphonia.
So my treatment just included getting my mouth basically rebuilt.
It's a hard recovery.
I went home with a feeding tube.
My palate, it felt like there was a balloon in my mouth.
You cannot speak, you cannot swallow in the beginning, because you have to conscientiously learn again how to swallow.
My swallowing wasn't good yet. That was actually something I had to learn, as well as learning to talk all over again.
And the fear of never being able to swallow was my lowest point of it. I was really afraid that I would not be able to get rid of the feeding tube.
I remember the nurse and my mother saying to me, "It's not going to stay this way."
And one day, this one therapist comes in, and it clicked. She just explained it to me the way I did it, and I was the happiest person alive that I could swallow. Because once you can swallow again, you probably can speak again, and everything looks a little less sad.
I was very afraid to speak. It's sort of hard to explain. You feel like there's something foreign at the roof of your mouth. It feels like there's this balloon. So I wouldn't let my tongue touch the roof of my mouth. So I would sort of talk like this.
It took a while. I had a very hard time with S sounds and SCHs, and I was just working on with a speech therapist. She gave me harder words and harder words every time, which I had to practice on when she came back, and then she listened to me if I was understandable.
They brought in a speech therapist. She came in and she spoke to me and she had me do some exercises, and she looked at me and she said, "You're gonna speak normally. This is all fear. It'll change." And I couldn't imagine it changing. And just, it got better. Eventually, you know, you heal.
Don't give up hope. For some people, it's just a slower process than for others. I think most people can understand me, and so I think I'm fine.
How is dysphagia and dysphonia treated? A speech pathologist can provide recommendations on a safe diet and perform speech and swallow therapy. This may involve specific exercise programs to regain strength and range of motion of swallowing and speaking structures. Long term, most patients do very well and resume a normal or near normal diet with appropriate therapy. However, some patients may experience long-term swallowing issues that impact the types of foods that can be eaten. A small percentage of patients have severe swallowing issues that necessitate the use of a permanent feeding tube. Each patient is different. Therefore, diagnosis and therapy are determined on an individual basis. Radiation therapy or surgery can also affect your ability to taste foods. Taste changes caused by radiation treatment usually start to improve by 3 weeks to 2 months after treatment ends and may continue to do so for about a year. If salivary glands are harmed, then the sense of taste may not fully return to the way it was before treatment. Taste changes can also make it hard for some people to eat certain foods and maintain their weight. If this is true for you, consider discussing this with your doctor or dietitian.
Couple years. It was a couple of years. What surprised me about post-op was my tongue, portions of my tongue were numb. Easily for over 1.5 years, which was news to me. So things didn't taste the way I remembered them tasting. They didn't necessarily taste badly, and it wasn't that I was lacking that ability to tasting. They just didn't taste like what I remembered. So it affected my appetite.
Another common symptom among head and neck cancer patients is lymphedema, or swelling of the soft tissues. This can result from surgery or radiation directed at treating cancer of the lymph nodes. Up to 75% of patients will manifest some signs and symptoms of lymphedema after treatment for head and neck cancer. Lymphedema is often worst first thing in the morning and after periods of inactivity. It tends to improve with being upright and mobile. Lymphedema can also occur internally, involving the mucous membranes of the mouth and throat. When present, internal lymphedema can cause changes in voice, difficulty swallowing, a sense of something being stuck in the back of the throat, and in severe cases, difficulty breathing. Chronic lymphedema can lead to worsening inflammation and permanent fibrosis or scarring of the tissue, leaving them stiff or woody in texture.
A little bit in the neck. I actually went for some lymphedema therapy, and at that time, it was 2 or 3 sessions. They taught me how to do some massage, but they also taught me neck stretching exercises, because I would get a little jolt once in a while for 6 months after my surgery. But that's pretty much calmed down, and so the therapy worked pretty well.
The most common and widely accepted treatment method used for lymphedema is called complete decongestive therapy, or CDT. CDT is a series of techniques including 1. A form of massage known as manual lymph draining. 2. Compression bandages or clothing with special padding. 3. Exercises to improve the flow of lymph. 4. Skin care to the affected areas. CDT has been shown to have lasting effects to decrease the severity of lymphedema at all stages and can improve a patient's overall quality of life.
Hello again. That concludes the second video in this 5-part series. I look forward to seeing you next week for the 3rd video. When you are done, close the video, click on the video icon to connect back to the program coordinator.